Hi, I'm Dr. Ron Miller, and this is Dr. Trey Martin of Pursuit Physiotherapy. And today we're going to go over and outline exactly how you can get back to throwing after having Tommy John surgery. So, there's a lot of stuff out there on this. We're going to kind of walk you through each phase and what you should expect after surgery, and then kind of guidelines and goals that you have to reach to get back through each phase, to get back to throwing, to get back to performing, and not only reaching your pre-surgery level, but getting past that, getting a 120% back, getting back to optimizing performance and preventing any injuries from occurring. So after someone gets Tommy John surgery, what does phase one look like for them, and what should they expect?
So the key point in phase one, we'll make this like say the first month, you really want to get elbow extension back. So if you don't know what I mean by extension, I mean your elbow should be straight out to whatever the opposite side is too. Some people have a little bit of hyperextension of the elbow, so you want to maximize extension first. During this phase, you're going to be fairly gentle into elbow flexion, which is like a bending motion. That's going to stress the graft site. So basically maximize elbow extension first. That's going to be huge. You're going to want to maintain soft tissue quality. Oftentimes the bicep can get kind of sore being in a sling or whatever it is, or some type of brace. So maximize extension first. Elbow flexion will come a little bit slower, but that's going to be an important part of the process. And then also too, maintaining wrist range of motion. That's something people don't really think about, but our wrist flexors are located right above where the UCL resides. So it's going to be important to maintain wrist flexion and extension and keeping that range of motion high quality. And then this is also a time too where you can do a little bit of light cuff strengthening. That's really not the focus of this phase though. So phase one, we're really going to hammer home extension first. Flexion will come along with that. But really during the first month, we want that to be complete and full. And we want flexion to be progressing to almost full after the first month.
Perfect. So phase one is really kind of following the post-op procedures, kind of like the guidelines, working on some range of motion right now. Then phase two, what does phase two entail after they reach those goals?
Yeah, so the other thing I didn't mention for like phase one and phase two, you're not going to really be allowed to do any type of gripping activities or really any type of active elbow flexion type stuff. So during phase two, assuming we get full passive elbow flexion and active elbow flexion and extension back, sorry, said that wrong, full passive elbow flexion and full passive elbow extension, then we can start working into active ranges of motion at this time. And this is going to be really dictated by a couple things. Your procedure, one, your surgeon's protocol, what they kind of like to see. So I'll talk a little bit about procedures. There's a new thing, I'm not sure if they're even doing it in Florida, but it's called an internal brace procedure. So what they've done is they've taken a collagen type tape and they've fortified either partial UCL tears or pitchers who are maybe older on in their career with an internal brace with this collagen tape. So this is going to be a lot more of an aggressive protocol, and we're not going to dive much into that, but for traditional Tommy John at this stage, you're going to be doing, you're going to start your active work at this point, and you can start adding a little bit of active wrist flexion extension too, and then you can also start doing things that are going to help improve your rotator cuff strength too, because one of the things we see is oftentimes if you're lacking things like overhead mobility, as in you can't get your arm overhead all the way, and you also don't have a ton of rotator cuff strength, that's going to impart more force in the elbow. So the elbow is a lot of times at the mercy of the shoulder, so this is a good time to really get some quality shoulder strengthening and then start to work actively on the surgical site as far as doing some light elbow bending, work on extension, and then starting to get some wrist range of motion back at this time. This will be, like I said, depend on the surgeon. Some are a little bit more conservative than others. Some are a little bit more aggressive. So they normally take the lead at this phase as far as healing goes. And I like to mention this with all post-op people. This is a majorly important time to make yourself a better athlete. You can still train your legs. Obviously, you can't squat or do like a power clean because then your elbow is going to be in deep position like that. But you have a ton of options here to train your legs with leg press, leg machines, stuff like that. And the other key thing too is we see a lot where you can do crossover training, so you can train your opposite side arm, and that'll give you some actual strength benefits. not to get too much of the weeds of that, but a lot of times the nerves cross over in the spinal cord, and so we can see effects from training the left side on the right side. So that's not going to be as quality, but it is a good way to maintain some base level of strength using that type of principle there. So that'll be phase 2, starting to work on active range of motion, making sure you have full passive range of motion. That should be full and complete at this stage. And then really starting to look at how we can train the body in other ways and start improving quality of motion and maintaining soft tissue integrity.
I think one key thing that you said was you can still train other things, looking at shoulder impairments, looking at thoracic rotation, working out legs. There's other things that you could do, not only just focusing on the elbow in preparation to get you ready to be 100% ready to progress throughout the phases. So that was phase 2. The main thing is, it sounds like reaching full elbow extension and elbow flexion, and then addressing some of the other things. So as you get into phase 3, what does phase 3 look like? Are they able to start strengthening the elbow and wrist flexors, or what does phase 3 look like?
So at phase 3, we'll say at the end of phase 2, you're fully good with passive, and then to progress out of phase 2, you also can actively flex and extend your elbow. So then when we get into phase 3, we can start adding some strength onto these things. You'll be cleared to start doing wrist flexion, extension, and gripping exercises, along with elbow flexion exercises at this phase. It's going to be majorly important too to keep up with your cuff strengthening at that time and really progress that. This is a good time to really light fire to all the other programs for legs, lower body, core, and shoulder care at that time. But this is going to be pretty much a hand-in-hand progression from phase 2, where we're now doing more active motions, some dumbbell exercises. It's still going to be fairly light at this phase. You never want to try to microwave a post-op surgery process. Tommy John surgery can take anywhere from 12 to 18 months to even up to 2 years in some cases to really have full resolution of issues. So it's going to be key at that time to still continue to maintain soft tissue range of motion, really make sure that the biceps is not giving you any issues. So a lot of times we see the biceps can get a little bit limited from a soft tissue perspective. So your therapist can help you work through that and start achieving some good soft tissue quality gains there while progressing all your other programs. So phase 3 is kind of a transition from phase 2, obviously, where we really start stacking on some strength and starting to rebuild the structures.
Okay, so this phase may be pretty long because you have to get full range of motion and keep it, and then you have to load the muscles around the elbow and shoulder. So you may be in this phase for months, because the next phase is the return to throwing program. So you may be in this for like a long time until you can actually tolerate or have the strength to be able to tolerate throwing again. So this phase may be the longest phase because it's going to take a while to get that strength back. And then as we progress to phase 4, which is a return to throwing program, what does this phase look like for someone after having Tommy John surgery?
Yeah, so from a timeline standpoint, normally we're going to start looking at return to throw probably around month 7 to 9, somewhere in there. It depends again on how you progress through the first phases. But at this stage, you're going to want to have, as I mentioned before, full passive range of motion, no doubt there, and you're going to have a fairly good base level of strength. From there, we can start doing things like med ball plyos. That's going to be our bridge from normal strength training to starting to get our arm ready for the ballistic forces that throwing is. So that's going to be things like overhead med ball tosses. We can do wall dribbles with a med ball too. And we're just going to start really adding fuel to the fire of our arm training program at that point. From there, you're going to start with a pretty conservative throwing program. At this point, like I said, you're probably at the 6 to 9 month mark, depending on how you've progressed with things. So from there, you're going to start pretty light with short toss. You're going to do a lot of just really light tosses. So you're going to want to manipulate your volume and intensity at this phase. You're not going to want to go all out. So maybe the first week you're doing 50% intensity for 20 feet and you're doing 20 throws. And then the next session you move back to 30 feet at the same intensity. So that's going to be more of a systematic approach, and that's going to be dictated by your personal needs, your surgeon's input, and then also the therapist that you're working with. I think it's important to note, I've discovered this in working with a lot of baseball guys, is a lot of times at this stage, insurance actually doesn't cover. So a lot of times insurance will cover the surgery in the first 6 months of rehab, and then as soon as you get active elbow flexion and extension back and you can hold like a cup and drink a cup of coffee, they say, okay, you're functionally okay for normal life. But
That's
obviously,
ridiculous.
yeah, you can't throw at that point. Cool, you can drink coffee, but so one of the great ironies of Tommy John surgery is it's specifically to help baseball guys get back to throwing. You don't necessarily need your UCL for normal life activities, but you definitely need it to throw a baseball and do weightlifting movements like a clean or a snatch or something like that. But basic daily life, you don't need one. So they do this surgery, and then after 6 months, you get limited results. You can't throw. You're still 6 months plus from throwing. So we see that as kind of a flaw in the system, but you can look at places like we have a pursuit throwing program that kind of fills this gap, and there are providers reaching out trying to make it cost effective to help you return to throwing completely without just spending a bunch of money out of pocket. But that is kind of the troublesome part of this phase, is a lot of times a lot of athletes lose guidance. So kind of one of the highlights of this video, I want to make sure you guys know that this is a thing that happens, but there are solutions out there to get you from this stage back to throwing.
Yeah. During a return to throwing program after Tommy John surgery, is the throwing program more conservative and takes longer compared to like rotator cuff ones and labral tear ones? Or is it really just individualized regardless that you go off of the response and how fast the athlete's progressing on this? Or is it slower than other surgeries?
I would say it's slower than what you'd see with maybe a labral or like a minor rotator cuff. It's probably actually a little quicker than a full rotator cuff tear, but yeah, it's going to be vastly dependent on how well you've progressed. If you've hit all your milestones, if you have good strength, you've really been training hard, you've been busting your butt in the gym, then as long as you have a good response to things, you don't have an increase in elbow pain, you can progress. With Tommy John, though, you do want to be fairly conservative. You see a lot of times, like, if you're watching this, I'm sure you're a baseball guy, so you follow the major leagues a little bit. You'll see some baseball guys get back in 12 months, and they look good. I remember Zach Wheeler, who's a Mets pitcher, he was out for, I think, 18, so he missed the better half of 2 seasons dealing with this. So it really does depend a lot on how well the surgery went, were they successful with the grafts and making sure you have a really good surgeon there, how good the rehab is. No offense to the Mets, but the rehab is not the best looking at some of the results. So
we'll have to tag the Mets in there off of that comment.
So clearly Wheeler was not getting the best, and that maybe took him a while, but those are going to be some factors. And then another factor too will be just, again, are you doing your homework? Are you training the rest of your body? So we know that if you have full overhead range of motion and a good quality rotator cuff strength, you've worked on your wrist flexors, extensors, and pronator mass, and also your biceps at this time. This is really going to help offload some of the stress on the UCL. So conceivably, you should progress a lot faster if you've been doing that. You've built good, solid, quality muscle. That's going to offload your UCL strain. So when you go through the throwing program, you're going to have a lot less pain and setbacks. So you're going to be able to progress quite a bit quicker than someone that just doesn't do anything. So
perfect. So you're going to have full range of motion, not only just elbow range of motion, thoracic rotation, shoulder motion. You're going to have advanced strengthening done right now. Your rotator cuff's going to be great. You'll probably be doing some legs, definitely with that, core strengthening, and starting plyometrics, also working on the biomechanics of throwing again, using functional movements, and then you're going to start your return to throwing program right now too. So, and then phase 5 is what I like to call the sports performance program. This is where not only are you trying to get back to where you were, but you're trying to optimize and reach your peak performance and get back to 120% of what you used to be. And this is where we have a pursuit throwers program, which we designed is to maximize this phase now. Can you tell them a little bit about the pursuit throwers program and what that entails?
Yeah, so this is really going to be putting the first 4 phases on steroids, to use a nice little baseball reference here. So we're really going to ramp up rotator cuff strengthening with this program. We have a full 3-month, it's a 3-phase rotator cuff arm care program, and it's going to take you step by step of increasing rotator cuff strength, increasing overhead mobility, and also just developing a great baseline for the muscles that you use while throwing. And on top of that, one of the major things you're going to see with velocity that most people don't know is a lot of your velocity is going to come from lower body strength and how much power you can transmit through the ground. So what does he always say? That Roger Clemens said that his money makers were his legs. So one of the things that our program entails is a full body strength and conditioning program. So we believe our athletes that are baseball players, you need to be an athlete first and then a pitcher second. So you need to develop a lot of quality lower body strength. And we also do a lot of more unilateral work here too. One study that I read before was there's a correlation between your Y balance scores, which is a single leg balance test, and risk of Tommy John surgery. So if you're somebody that's at risk for, or you've already had Tommy John, then one of the things we can look at is there's going to be a likelihood that you don't have great single leg strength, and that can transfer to things like your throwing mechanics, your pitching performance. So our program is going to tackle things like that too. We're going to make sure you have really quality hip strength. You're going to have rotational power. If you think about pitching too, you need a lot of power through your torso to transmit speed and velocity through your throws. Then the other thing too, my favorite part of this program is we have a once a week in-person session, and there we're going to work on soft tissue work. We're going to do myofascial work. We're going to do thoracic manipulations if needed. We're really going to try to maintain your range of motion that you've gained over the past few months throughout the course of the season. We're going to make sure your arm feels like $1 million at all times throughout the course of the year. And from there too, we can discuss like how to optimize your training, different factors too, like how many pitches should you throw, how do we ramp up smartly. One of the things that we see, not just with Tommy John guys, but a lot of baseball guys, is they go from doing nothing all winter, then season starts, and even in the MLB, we see the highest spike in injury risk is in April. So we have to progress smartly, especially coming off something like Tommy John. You can't just get back to, okay, your max capacity is 50 pitches. Well, now I'm going to go throw a game. Yeah. So that's one of the things, too, we help manage from a performance aspect. And it is athlete-minded. I don't want to put it as like we're going to be the doctors that are like, hey, you can't do this, you can't do this. I understand the realities of the sport. I played it for a long time. So we'll help you make smart choices, though. We want you peaking for the showcases when the scouts are there, or when the D1 scout's there, when the pro scout's there, not in the random tournament on some weekend on a middle school field where no one's there. So that's all part of the program, is 24/7 access to us, but also 1 day a week soft tissue care, working on range of motion, strength, and then you also get the full strength and conditioning program for the gym, and then the full arm care program too. So it's really comprehensive, and it's going to help drive performance, help people increase velocity safely, and not using just cheap hacks like a weighted ball and stuff like that. We could go off on that for a while, but so it's going to really try to help achieve a clean velocity and minimize injury risk as much as possible.
Will they be doing deadlifts after Tommy John surgery in this phase?
In this phase, yes, but not very quickly after. Deadlifts and gripping exercises take a long time to get back to with Tommy John.
In phase 5, though.
In phase 5, yes.
This is the deadlift rack here in the Pursuit Performance Lab, where I do 350 pounds and Trey does 150.
We're gonna have a deadlift competition soon, though.
So hopefully you guys enjoyed this, and this was informative for you if you're going through this right now, or thinking about, or you need Tommy John surgery. It outlines the phases that you have to get back to throwing, and now you have an idea of what to expect, what to reach in each phase, and how long it's going to take you. So if you have any questions for us, you can put it in the comment box below. If not, you can find us online at pursuittherapy.com. Again, we are here to help you. I hope you found this video informative, and please don't hesitate to reach out to us if you have any questions or concerns. Again, it's Dr. Ron Miller, Dr. Trey Martin, and that's with Pursuit Therapy, and our website's pursuittherapy.com. Thanks for listening.
Thanks for tuning in, guys.